What the Vanguard movement is all about is innovation and cooperation. And what you will see is great relationships and friendships actually come from the Vanguard movement.
In Tower Hamlets, we have a population that has ill health at an earlier age. The healthy life expectancy in Tower Hamlets for men is 10 years lower than the national average, and for 7 years lower than the national average for women.
We've been doing a lot of work on defining what we think Tower Hamlets Together is. So we're moving right away from anything disease-based. We're moving away from care which is defined by the way providers structure themselves. People need knowledge, skill and confidence to be able to successfully self-care, and the biggest one is confidence. And so very often people will need some guided support. You know, if somebody has an issue that they want to address, I can refer across to a social prescriber who's then able to spend much more time helping people set really clear plans.
The social prescribing team will spend typically an hour with a patient drilling down into what's really important to them in their lives, and then potentially connecting them to 1,500 voluntary sector organisations in Tower Hamlets.
Much more an emphasis on how people are living their lives and then what happens to their health, rather than we usually start with an illness and then try and backtrack into how people have been living their lives.
And that's when you'll get the best outcomes for patients, is actually when you're a partner with a patient, rather than the old-fashioned approach, which is just to say to a patient, just do this or take this drug.
It's the Older Persons Rapid Access Clinic. It is a clinic for anyone over 65 in Tower Hamlets who the GP or the multidisciplinary team are worried about, or colleagues in A&E or colleagues in the physician response unit, to come up and get a consultant in geriatric medicine, a nurse who is a mental health trained nurse, an occupational therapist and a physiotherapist assessment, and try and do all those assessments and investigations in one day.
It's been quite good because you get to work more closely with your colleagues. You have, I suppose you get to see it from their point of view as well, and not just a nursing aspect.
The benefits for patients coming to our clinic is that they've got access to all the therapists, they've got access to the consultant, the mental health nurses and the normal nurses as well.
We might not cure all their health problems, but if we can address what's the thing that's making them feel worse and address their well-being and promote independence, then we've been successful.
Yeah, well, I think the integrated care is a very good idea, and I think the social services should work with the medical services and all the hospital and everything, because when you come out of hospital you're still, you still need care, don't you? So if they're all working together, it could work.
Our outcome framework is all about what do we deliver for the people of Tower Hamlets.
We estimate that we can probably reduce attendance in outpatients by about a half, with much better care for patients and with much better patient experience.
I feel it's been transformational for me as a clinician, that we've been able to do a lot more in a short period of time and avoid a lot of the duplication.
It's just been great fun, actually. There's always something interesting happening. You're learning new things every day. You're meeting people who are absolutely energised by what they're doing. And that's an amazing atmosphere to be in. A lot of stories you'll hear about the health service now, about the challenge, the long hours, GPs resigning, practices handing in their keys. Actually, what the Vanguard movement is about, bringing back the joy into people's lives and coming up with amazing innovations